Dear students, welcome and thank you for tuning in to this video. I'm Dr. Loyal Zobi. In this series of videos, I will be discussing measurement of the respiratory system. In particular, I will be talking about respiratory therapy and some instruments that we use actually to help people breathe. Specifically in this video, I will be talking about what is the respiratory therapy and how do we define it and why it's important, and then I will talk about inhalators, their design and how we use them, and what are the key factors or components in designing inhalators for biomedical engineers. So what is the respiratory therapy and why it is important? So when a patient actually is incapable of adequate ventilation by natural processes, mechanical assistance must be provided so that we have sufficient amount of oxygen is delivered to the subject, organs and tissue. We need to not permit for carbon dioxide actually levels to be building and accumulating in the tissue and the organs. So that is actually the challenge and the problem. We are going to be relying on mechanical assistance to provide oxygen and to remove carbon dioxide. So the procedure and instrumentation involved in providing mechanical assistance in respiration and in supplying hypoxic patient with higher than normal concentration of oxygen or other therapeutic gases or medications actually is the field known as respiratory therapy. When a patient has hypoxia or a hypoxic, actually they have deficiency in the amount of oxygen reaching the tissue and the organs of that patient. This is the definition of the field of respiratory therapy, and I would wanted to highlight that the importance of mechanical assistance in solving such a problem. We are in medical instrumentation class, and I would like to talk about the instruments used actually in respiratory therapy. They include inhalators, which are the ones that we will be talking about in this video. In the successive videos, I will be talking about ventilators, respirators, and also positive pressure breathing apparatuses, resuscitators, humidifiers, nebulizers, and aspirators. So if you want to learn about these, you need to watch the videos and understand the concept and the functionality of each of these instruments. Many of these instruments, however, have overlapping functions, and the name used for a particular device may vary among manufacturers. So the first part of the class, we were talking about electrical instruments. Now we would like to talk about some mechanical instruments. However, they have electrical components as well for control, and we will be discussing that. But I will start with the simplest one of them, which is the inhalator. An inhalator or a puffer is a medical device used for delivering medication into the body via the lungs. It is mainly used in the treatment of asthma and chronic obstructive pulmonary disease, or what we call it COPD. And in the slide here, the right of the slide, you see an image of an inhalator, and it's a very simple piece of equipment and a very simple tool. Before I go there, I need just to explain what asthma is and what COPD. So asthma is a respiratory condition marked by spasms in the bronchi of the lungs, and it causes difficulty in breathing, and it usually results from allergic reactions or any form of hypersensitivity. Now, for the chronic obstructive pulmonary disease, it is a chronic inflammatory lung disease that causes obstructed airflow from the lung. Symptoms include actually breathing difficulty, cough, mucuses production, and it is typically caused by long-term exposure to irritants, gases, or particulate matters, most often from cigarette smoking. People with COPD are actually at increased risk of developing heart disease and lung cancers and a variety of other conditions. And if you recall from the previous lecture, we talked about chemosensors in the lungs that are actually can increase or decrease respiratory rate. Irritants are actually very important in affecting our respiratory rate. So I just wanted to make sure that we are on the same page when it comes to where do we use inhalators and why do we use them. Mainly it is used to supply oxygen and other therapeutic gases to patients who's a patient who is able to breathe spontaneously without assistant, and that's one of the important conditions about using inhalators. and they are used when a concentration of oxygen higher than the air is surrounding air is required for the patient or the subject. The parts or the components of the inhalator of an inhalator. So we have three main components. We have first the source of the therapeutic gas, and in this image here, this bottle here which has the gas or the therapeutic agent that we would like to deliver to the subject. And then we have the equipment for reducing the pressure and controlling the flow of the gas, and that's this part here, the red part of this image. And also we'd like to have a device for administering the gas, and which is this part, this component or part of the inhalator, which directs the gas to go inside the mouth. From an engineering point of view or a biomedical engineering point of view, we would like to be able to optimize these parts or components of the inhalator, and there are a lot of designs and products available. And as an engineer, you can look at these products and you can find out what challenges or problems exist in each of those products, and then we can come up with a need statement and then design a solution with a better better inhalator to provide a solution for these challenges. And you can check Amazon or check any of the e-commerce websites, and people will leave comments about their experiences, and this is a good source for us to identify challenges and problems, and to come up with solutions and better inhalators for people. Devices for administering the gas to patient include, and that is the third component of an inhalator. As I mentioned, it could be this static just component of it, just to direct the gas to go inside the mouth, but it also could be nasal cannulas and catheters, and also it could be face masks that cover the nose and mouth. And it's also in certain settings for pediatric and children, we use oxygen tents. And the oxygen concentration presented to the patient is controlled by adjusting the flow of gas into the mask or the tent or the cannula. So I just wanted to make sure that also this is a very important piece or component of the inhalator for engineers to design and optimize. And because of the pandemic and COVID, a lot of interest now is actually is shown in designing better components for the inhalators, right, specifically the device that for administering the gas and all the therapeutic agent. Thank you for watching till this point. I'm going to be talking in the following videos about ventilators and respirators and all the other instruments that are used in respiratory therapy. So stay tuned. Thank you for watching. If you have any questions, please leave them in the comment section, and I'll be more than happy to answer them for you. Thank you. Until the next time. Bye.